Stephanie, I'm just surprised this time you had so much plaque. What's going on?
Well, I don't understand. I use the electric toothbrush and they say it works wonders and it worked for me. I don't understand. I do it every day, twice a day.
Twice a day. Well, you know, I find that sometimes the toothbrush just doesn't quite get to the gum line all the way. And you're holding it at 45-degree angles against the gum line, is that correct?
Yes.
Okay. It could just be that you're not quite able to reach that last little part of the tooth next to the gums. So I have a little tool that I want to show you today. It's called a Sulcabrush, and it's a little double-ended brush that has tapered bristles on it. It's designed to clean in that part of the tooth that's right next to the gums, the sulcus, and underneath the gum line, that's the little space that's under the tissue. And you hold this like you would a pen. So you're going to hold it like this, not like this, which some people want to grab it like that and it's very awkward. So you want to grab it like a little pen, like you're writing with something. And then let me have you hold this near and I'll show you what it looks like. You're actually going to hold it at about the same angle that you would a toothbrush, almost a 45-degree angle, back and forth right at the gum line, and you let the little pointed bristles get up under the gum line. And the nice thing about this is you can clean between the teeth by doing this. Can you feel how that gets in between the teeth? It's not quite as good as floss because it doesn't get up under that little triangular flap, but it cleans pretty well. So you use this end on the cheek side. It actually says outside on the handle. Can you see that?
Yes.
Okay. When you flip it around, this side says inside. Okay. That means you use it on the tongue side. So on the tongue side, again, holding it like you're writing with a pen, you go on the tongue side gum line of the tooth, rub it back and forth to scrape off the plaque. But instead of a 45-degree angle to the long axis, I'm actually maybe out kind of like 70 degrees from the long axis of the tooth, because that lets it get the bristles into the gum line a little bit better all the way around. And again, you can use it in between and kind of massage with it as well. Let me show you on the type it in, then you can see a little bit better outside the mouth. So again, this end says outside, so I'm going to use it on the cheek side. 45-degree angle, rubbing it back and forth against the gum line. See how easy that is? You can go all the way around the back tooth, so if you have a wisdom tooth, you can go all the way around that back corner, and you can clean in between. I tend to go all around the gum line first and then come back and do the in-between, but you can do it either way you like.
And how often should I be doing this?
I think it's good to do it at least once a day, and I think it's best to do it either after dinner or at bedtime. Okay? The nice thing is after you've watched yourself do it a couple of times, you don't have to sit in the bathroom and do it with your toothbrushing because you're not using toothpaste. You're just using the plain old brush. You can do it while you're reading in bed. You can do it while you're watching TV at night. And you just put it on a clean Kleenex, and then I just rinse mine out in the morning and dip it in a little Listerine.
Okay.
So on the inside, remember, I'm going to switch it to this other end, and instead of at the 45-degree angle, I'm going to come out a little bit more, maybe about a 70-degree angle, so that I get those bristles into the gum line very well. And then I can clean with it as well. But see how it can go all the way around that back corner? Does that make sense?
Yes.
And it's such an easy thing to do. Our patients like it because they say they don't have to spend the extra time in the bathroom. They can do it while they're reading, watching TV at night, so it saves them some time. Would you be willing to try that?
I think I can try that.